Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about deep venous thrombosis, or deep vein thrombosis, DVT. DVTs are very, very common, and they're basically a deep vein blood clot that most commonly happens in the vessels of the calf or thigh, although you can get them in the upper extremity as well. Symptoms of DVT would be swelling in your foot, ankle, or leg, a cramping pain, severe unexplained pain in your foot or ankle, an area of the skin that feels really, really warm. It can also happen if it's in the upper extremity. It could be neck pain, shoulder pain, swelling to the arms or hand, blue tinted skin color, weakness in the hand. The big risk of DVT is getting a pulmonary embolism, or getting that blood clot to move to the lungs. And this can actually be very, very problematic, and even can ultimately be fatal if it is not carefully treated. So what are the causes of a deep vein thrombosis? Injury is the most common, especially bone fractures in the area can actually lead to that. Surgery can actually increase your chances of DVT. The biggest reason for surgery, however, is lack of movement, because it hurts, so you're trying to not move it, and you end up getting a blood clot in that area. Reduced mobility or inactivity. If you're lying down or sitting down a lot, it increases your chances. Certain types of medications. You also have a higher risk if you're overweight. If you have significant higher body mass, you increase your chances of a deep vein thrombosis. There are other things that can actually lead to a increase as well. Risk factors, for example, if you're smoking, as you smoke, it'll actually increase your chances, especially if you're a heavy smoker, increase your chances of deep venous thrombosis, because as we know, smoking, it actually causes the blood vessels to contract, which increases the opportunity for there to be clotting. Birth control pills or hormone therapy can have been shown to increase DVT. Family history, if you've had a recent catheter placement in the vein for some reason, that can increase your chance of having a damage to that area, which will cause clotting as well. If you have heart problems, that can also lead to the fact, because if you're not pumping very well, the blood will pool and it can actually clot as well. The funny thing is there can even be certain physical causes, like if you're pregnant, a woman is 5 to 10 times more likely to have a DVT than women that are not pregnant. If you're flying, because you're sitting for long periods of time, you increase your chances of deep venous thrombosis. The way you eat can also affect it. They actually have shown if you are high risk for DVT, then they recommend a Mediterranean type diet. So an increase in the vegetables and the oils that can increase or decrease the chance of getting a DVT. So increase the blood flow to decrease that chance. So how do you treat it? If you have a deep venous thrombosis, there are medications that can be used, anticoagulants like heparin, warfarin, enoxaparin, or Lovenox can all be utilized to decrease clotting. Compression stockings can help prevent it by preventing the swelling that might lowers your chances of having a clot that stays in that area. Filters can be placed if you do have DVT or you do have a tendency to clot, to keep them from migrating or moving somewhere else. So if you're saying, okay, I'm high risk for DVT, what can I do at home? What kind of things can I do at home? Move more. Exercise is one of the key pieces, and it's even just standing up and walking, not sitting for long periods of time in a computer, or sitting at even something like a sewing machine for long periods of time could actually be a problem if you're not moving regularly. Keeping your legs or arms elevated. So if you are going to be down, getting them elevated higher than the heart so the blood flows back to the heart easier. Compression stockings. This is especially important, for example, say if you're on really long plane flights, because that actually reduces your chances of getting clotting. So the idea, if you have a chance and you're worried that you may have a deep vein thrombosis or a blood clot in the leg, number one, you should go get an ultrasound and have it evaluated. If they have a problem doing that, they can actually do a D-dimer blood test or a venogram and actually evaluate whether whether you're having clotting issues as well. The big thing is that you need to get it treated quickly to prevent more serious problems. Especially if you say, okay, I feel like I've had a clot and now I'm having breathing issues, you should go to the emergency room and be evaluated quickly, because this can be life-threatening. So, deep vein thrombosis. The best thing you can do is be active, be healthy in the way that you eat, be healthy in your habits by reducing smoking, reducing those kind of activities, compression stockings if you have a tendency for your legs to swell, or if you're going to be sitting for long periods of time, and really just being a good, healthy individual in the way that you live your life. You can prevent these. They can be treated if they are a problem. The truth is, you should be evaluated on a regular basis especially if you have a history of deep vein thrombosis. This is Dr. Brandt Gibson. This is your Podiatry Tips